in listen-only mode.
Hi, everybody. Welcome to our Intro to NGN webinar. Sorry for the little bit of confusion today. We are making some changes to the program, and as a result, we've had to make some changes to our GoToWebinar assignments. And as a result, I'm now using a different login than I normally use. But then on top of that, I was in the office all day and I had to come home from the office to do these. And there was a bad wreck on the way home. So I had a lot of traffic backup and I apologize for being late as a result. But I'm glad you guys are here. It looks like we got almost, well, over 15 people in the class. So that's awesome. Glad to have all you guys here. And let me get our webinar up here for you guys and we will get started. Let me put this on this monitor and then we'll do from the beginning. And let me now share my screen for you guys so you can see the slides. Sharing the screen. Okay. So you should now be able to see the slides. It should say Next Generation Nursing NCLEX. And if you would just go ahead and somebody give me a shout out to say, yes, we can see the slides and we can hear you and everything seems to be going according to the original plan now. Hopefully that will be the case. All right. Thank you, Ria. I appreciate that. Thank you, Abdul and Mark and Dorcas. Thank you so much. Hi, Priscilla. Thank you as well. All right, guys. So I know some of you are probably new to the program. Thank you, James. And so this may be, you know, you're coming here to this webinar because you've just started the program and we tell you, you need to come to this webinar as part of your getting started with the program and learning about how everything is going to function. A few of you, though, are probably here because you were planning to test in March, but with the sheer number of people that are trying to test in March, it became really, really difficult for us to get test dates as well as to get flights for people. So some people got moved because we just couldn't get a test date for them in order to get them to test, and others because we couldn't get them flights to go to there. I mean, we had, you know, we were looking at flights that were going to cost us, you know, close to $10,000 to send somebody to test. And that's just really not, you know, cost effective when we could just wait a month, right? And it's not going to be quite so much. So that's, you know, we had to think about being fiscally responsible as well. And we do want you guys to know that the NGN is not as scary as people made it out to be, right? It seemed like it was going to be scarier. Partly due to the fact that because of COVID, the regular scheduled changes that the NCLEX, the NCSBN does every 3 years didn't get done. And as a result, we went, I don't know, 5 to 6 years without an update to the NCLEX. And so because of that, they're feeling like it's a big change compared to the kinds of changes that we've had in the past. Well, that's really not so much the case. NCSBN has always regularly updated the NCLEX. And so this is just the next, the next generation of updates, right? Really and truly. So we hope that by the end of this presentation and at the end of your conversations with your instructors, that you're feeling more confident about this exam and less anxious, and know that you are prepared. That you will be able to answer these questions successfully because the changes are really not that radical, number one, and all of the things that we have taught you all along and all of the content that you have studied all through the program is exactly the content that's going to be tested, and all of those skills and strategies and steps that we've taught you are effective to solve all of those NGN type questions, as well as the standalones that will be similar to the previous versions of NCLEX. So let's jump into this and hopefully we can put your mind at ease, right, about how this exam works. So this is the deal. The questions that most people have is, who does this affect? Well, it affects everybody. Anybody who takes the NCLEX will now be taking the NGN unless they test in the next week, right? So anybody that tests after the change goes into effect, which is the answer to the question of when this will start, is April the 1st. Okay, so every single person who takes the NCLEX from April the 1st forward will be taking the NGN. And it is happening everywhere in every single test center. This is not a rollout or a gradual adjustment that's getting made. It is happening everywhere in a moment in time. So everybody that tests on March 31st gets the current version NCLEX, and everybody that tests March 1st and later gets the NGN. It's a straight up change as of midnight, end of the March 31st, beginning of April 1st. So just know that that is the case, okay? And the next thing people ask is, what's changing, right? What's changing is the way that they're presenting the questions. That's really the biggest change. They added in some case studies. There's only 3, right? And they each have 6 questions. So that's really only 18 questions that are case study questions. All the rest of them are standalone questions, just like the NGN has always been. So it's not a huge change. The case studies are not making that big of an impact as far as, the difference in the exam itself. There are some different presentations of questions. So there's different kinds of select all that apply, really, and multiple choice. And that has to do with the drop down boxes. It has to do with the drag and drop boxes. And we're going to look at each of the different question types over the next few slides. And that will hopefully make you feel a little better about what this is. And then, so other than that, it's just a couple of different types of standalone questions in addition to the case studies that are new, the bow tie and the trend questions. But all the other questions are going to be pretty much just like they've always been, with the difference being just how they're presented to you. And so then the big why, right? The big why do they want to do this? Well, the reality is, like I said, NCSBN does a practice analysis every 3 years for the way that nurses are practicing and being expected to practice as entry-level nurses. And what we know is they are actually having to take care of more critically ill patients than ever before. And as a result, they really need to be able to have effective clinical judgment to make more complex decisions. And so in CSBN said, well, we have to be able to measure how well a nurse can apply critical judgment and good nursing judgment to a situation to make sure that they're going to be a safe and effective nurse. So that's really all this is about, right? And it's the same thing that the NCLEX has always been about. Safe and competent nurses coming out of nursing school, passing this exam, and going in to take care of patients. And that's the same really that it is in any country, right? Every country that has a professional nursing exam, that's the goal, is to make sure that the nurses taking care of patients in that country are safe and competent nurses. That's it. So it's no different than any other exam in that respect. But as we do know, and as those of you that are new are going to learn, it is a different kind of exam. And so the way that it tests is different. And so those of you that have been in the program long enough, you have already seen the different kinds of NCLEX questions and the way that you have to think about NCLEX questions and why that's different than a straight up knowledge question that you would have gotten, for example, in nursing school. And those of you that are new, you're going to learn that as we work through the program. So just know that we're here for you. We're going to give you all the support you need. And those of you that just got extended from March to April, and now you got to take this new test, just know you're going to be able to be just as effective on the NGN as you would have been on the current version. So let's look at some of this. What are the big differences, right? So the differences and the similarities are this. The time allowed is the same, 5 hours. And they actually did some kind of focused reviews where they had people taking both kinds of the exams and realized, because we did think, I'm sure they, initially they did think that the case studies were going to cause people to need more time. And that's why they did those, just to verify and see how much more time people were going to need. And what happened was they found that people didn't need more time, right? They were able to answer the case study NGN type NCLEX just as well as the current version in the same amount of time. So the NCLEX is the same. It's 5 hours for the current version that only is in effect for the next week, and the NGN that starts April 1st. And the type of questions that you get, the delivery method, is still variable length computer adaptive testing. There's an asterisk next to that on the NGN side. The reason is because the computer adaptive element is only for the standalone questions. The questions within your case studies are not computer adaptive. They are preset for that case study. You're expected to move through that case study in a specific manner that is called the nursing clinical judgment model. And so we'll look at what that looks like in a few slides to help you make or have a better understanding of how that works. But overall, because remember, that's only 18 questions out of actually 150. So that's going to be what, 132 questions that are standalone questions. So those are those computer adaptive exams. And the variable length means it's going to close at different points depending on how the person is performing. So those pass-fail decision points start with what's called the confidence interval. That's that 95% rule. And basically, the best way to understand that is that 95% of the questions answered from question 85 forward on the NGN, the same as from question 75 forward on the current version, when 95% of the questions answered at whatever point in the exam from that minimum number forward are above the passing standard, you get a pass. It closes and you get a pass. If you don't ever trigger that, right, the opposite rule can also be triggered. And that is if 95% of the questions are so easy, the difficulty level is so low that you have 95% of them below the passing standard from 75 on the current version, 85 on the NGN going forward. Then if you trigger that 95% rule, it will close at whatever question that is and give you a fail, right? So it's really about, getting as many correct as possible so that you stay above the passing standard and having hard enough questions that even if you miss it, it's hard enough, it's above the passing standard, it's still counting towards your pass. So you can trigger that 95% rule. Now, not everybody's going to do that. Only about half of the people, right, trigger the 95% rule. The other half of the people keep getting questions from 75 on the current version, and it'll be 85 on NGN forward. So know that if your exam continues to pass that minimum number, you're in good company. You're in the other 50%, right? And that other 50% gets anywhere from 76 in the current version, it'll be 86 in the NGN, up to the last question before the very last question, okay? So when your exam is going, if you haven't triggered that 95% rule on either side of the passing standard, that's what makes the program give you another question. And it will keep giving you another question until you trigger one of those rules, either 95% above or 95% on or below the passing standard. Now, some people don't actually ever trigger that rule. And one of two other things happens. Either they use all of the 5 hours that's allotted to them. And please, please, please think about your exam not as running out of time. Even though that's what they call it, you are not trying to beat the clock. You are trying to use as much of that 5 hours as you need to answer however many questions you get. And so your goal is not to be done in less than 5 hours. And your goal is not to answer all of the questions. Your goal is just to answer each question as they keep coming, one at a time, using however much time you need to answer it successfully and move on to the next question. And however much time that takes altogether, that's how much time it takes. And if it takes the entire 5 hours, that is fine, because this is what happens. If the exam closes because you hit the 5-hour time limit and you're at, say, question 1 to 30, well, guess what? All of those questions from 1 to 130, minus the 15 that are not scored, are going to be used to calculate an ability estimate. And if that ability estimate is above the passing standard, you will get a pass. If it is on or below the passing standard, you will get a fail. But they're going to use all of the questions. Now, if instead you get to the very last question, so the current version it's 145, on NGN it'll be 150. If you get to that very last question before the 5 hours expires, the only question that is used to determine your pass or fail is the very last question. And all that those previous questions did for you was get you somewhere in relationship to the passing standard for that very last question. And if that very last question is hard enough, it's above the passing standard. Even if you get it wrong, you will get a pass. But if that very last question is too easy and it's on or below the passing standard, even if you get it right, you will get a fail. So remember, your goal is not to be done in less than 5 hours, because we would much rather the exam use all of the questions that we've answered rather than just the very last question we answered to make our decision. You have a better chance. But that doesn't mean you can't pass if you do get there. We have lots of nurses that do pass on the very last question, but it comes because they took their time. They didn't rush. They thought through their questions. They used their steps and strategies. They applied their knowledge. They did the things that we recommend to them that they do, so that they had harder questions as they approached the end of the exam, and they were above the passing standard when they hit that last question, and that got their pass. And that's how it works. So you have to be very cognizant that you're not rushing through this exam, okay? And your adaptive exams and Nurse Achieve are your practice for this, right? So that's what you want to make sure you're doing. Now, the nursing clinical judgment measurement model case studies, the current version does not have any. The NGN will have 3 of them in the first 85 questions. So every single person who takes the test will get 3 case studies, right? And those 3 case studies have 6 questions each, so it's a total of 18 questions. Now, each of the exams, the current version and the NGN, both have 15 questions that are being tried out. They are not scored items, and they are being evaluated for their worthiness to be included in a future version of the actual NCLEX. And so you don't know which questions they are, but they also will come in the first 85 questions on NGN, the first 75 on the current version. So that means that the total standalone questions that are scored in the current version are 60 to 130. The total questions that are scored on the NGN, because of those 18 that are case study questions minus the 15 that are not scored, the total standalone scored items is 52 to 117, and the total scored including the case studies is 70 to 135. So that's the real differences as far as the data of the exams. And so we want you to understand you're not getting significantly more exams, and the questions are not going to be any different. The actual difficulty level, the passing standard, is not changed. It is exactly the same for the current version and the NGN version. So your difficulty level of questions is not going to be any different than what the current version is when it comes to how hard are the questions. So we want you to take a deep breath and know, okay, I'm going to be able to do this, especially those of you that got, pushed from March to April, because we know that's been a fear or an anxiety producer at least. And we want you to know that, this exam is not going to be any harder than the current version. Okay. So the next thing we want to talk about then is kind of new screen views, how the questions are going to be presented. So currently, the NGN presents the questions where the scenario, the setup for the question is at the top of the screen, and the question is at the bottom of the screen. Well, what they're going to be doing going forward on April 1st is everything that you need to know in order to answer the question is going to be on the left-hand side of the screen, the way this is, and the question itself will be on the right-hand side of the screen. The reason for that is it allows them to set up tabs and have more information available to you as needed based on the kind of question you're answering and what the question is about. So this is an example of how a specific kind of a select all that apply will be presented, where all of the information is on the left, and then you're asked to make a decision about things that are happening in that nurse's note to answer the question is going to be on the right. This is another version of that, right? You have the question, and then they give you, this is called a matrix multiple choice example. They give you an option for different assessment findings, and you have to decide based on what you read over here, does that particular assessment of finding indicate the person is doing better, that they're still the same, or that they're getting worse, right? And so that's how those work. So let's talk a little bit about that nursing clinical judgment measurement model. So how did they get to this? Like what is it that caused them to create this little scenario for us, right? Well, what they saw when they were doing that practice analysis this time around is that what's going on in nursing, as it has always been, but the reality of the patients being so much sicker than they have been in the past, is that the clients come in with specific needs that need to be met, and nurses have to make clinical decisions about how to do that, how to meet them. And the decision-making process is what we call clinical judgment. My patient needs this. This is what I need to do for them. How do I know that this is what I need to do to them? I have this judgment process that I need to work through to make that decision. So how do I make this clinical judgment process? What's the root issue here? Well, in order to have good clinical judgment, I have to be able to form some hypotheses about what I think is happening in my client. I need to refine those hypotheses to select the ones that are really the most likely. And then I have to evaluate whatever I do for the patient to make a decision about whether my hypothesis was correct and whether what I did for them was effective. And so in order to do this, there's a further refinement that needed to be made. How do we decide what the hypotheses are? How do we decide which ones to pick? How do we decide what the evaluation should be? Well, they decided that, okay, in order for this process to happen, these are the things that need to happen. The nurse needs to be able to recognize the cues based on their assessment of what's going on with this client that's not normal. And they need to analyze those not normal cues in order to make some hypotheses about what they think is going on. And then using those hypotheses, they need to generate some solutions. What can I do for this patient? And then once we know what the options are, we have to decide what are we actually going to do. And then we have to evaluate, was that effective or not effective? So this is your actual clinical judgment measurement model. And this is what your case studies are going to take you through. Question 1 in a case study will be about recognizing cues. Question 2 will be about analyzing those cues. Question 3 will be about prioritizing the hypothesis and deciding what you think is going on with that patient. Question 4 will be about generating some solutions. What can you do? Question 5 will be about actions that you will take in order to treat this patient. And then question 6 will have you doing some evaluation. All 3 of the case studies will take you straight through this process, question by question by question. So when you think about it, you guys, you're experienced nurses. You're actually already doing this every single day when you're at work. You walk into a patient's room and you make an assessment. And as you're doing that assessment, you're recognizing the things that are normal versus the things that are not normal. You're recognizing those cues and you're analyzing them to say, what's going on with my patient here? Well, they're having shortness of breath. They're complaining of chest pain. They're starting to look a little cyanotic around the mouth. They're getting sweaty and diaphoretic. So what do I think is going on with them? Maybe they're having a heart attack. So what can I do? Well, let me elevate the head of the bed. Let me put oxygen on them. Let me go grab some aspirin. Let me do rapid response, right? Like those are the things I can do. What am I going to do first, right? Now, what am I going to do first? I'm going to put oxygen on them. I'm going to call rapid response. I'm going to get the aspirin, get the crash cart, right? Those are the things I'm going to do. And then I'm going to evaluate the outcomes for what we did for this patient. And lo and behold, because I'm an effective and awesome nurse, my patient is doing well, right? We saved their life. And y'all do this every single day. So this is why we're telling you these case studies are not going to be as scary as you think they are, because you're actually already doing it. Now, in order for you to make these decisions, right, to work through this process, there are some things that impact your decision-making process. Some of them are external environmental factors that are related to the patient themselves and related to the hospital and the unit you're on and the shifts you're working and how much is going on. So there's a lot of stuff that goes into that. And then there are some inherent internal factors that are unique to the nurse, right? And so those things also have an impact on how we make our decisions. So we do take all of that into account as well. But this is how that process really works. So we're going to stay focused here when it comes to the case studies. Now, it actually does align very well with the nursing process when you think about it. It's just a little bit of a tweak. How is that? Well, look at this. Assessment, recognizing cues, what matters most. Nursing diagnosis, analyze the cues, what do they mean, and prioritize some hypothesis. Where do I start? What do I think is going on? What's my nursing diagnosis? And then generating a plan. What are the solutions that I can do? What are my hypotheses that I think are actually happening, and what is it I'm allowed to do based on that, right? So that's my plan that I'm going to do. This is what I can do. And then I'm going to implement. I'm going to take the actions. What will I do? And then we evaluate. How did it go? Did it help? Right? So it's very, very much like the nursing process. It's just a minor refinement in that nursing diagnosis step. So I think you guys will find that you're not going to be finding this to be as difficult as maybe it was kind of thought it was going to be, or for some reason made out to be at the very, very beginning when people first started hearing about this. And I think it's like anything new, right? People are always afraid of the new thing, right? The things that they've never done before, they've never seen before, like the new things are weird, right? So I think there's a lot of fear that comes until people really start to get a grasp of how this is going to work. And for those of you that are new to the program, you will get to do that process all the way through. For those that just got pushed from March to April, we're having to kind of do a very compact version of preparation for this. But like I said, you guys already do this. And it's only 3 case studies on the whole exam, which is only 18 questions out of 150, and the rest are all standalone. Now, the cool thing is the steps and strategies that we teach you can be applied to every question in your case studies. And the clinical judgment model can actually be applied to standalone questions as well. The difference being that a standalone question is going to be a snapshot of one of these sections, right? So the standalone question may focus on analyzing cues, or it may focus on generating solutions. Well, all you have to do is read through that standalone question scenario and walk yourself through the process. If I'm supposed to be generating solutions in this question, what are the cues I need to recognize that they give me? What do I think they mean? What are the hypotheses of what do I think is going on with this patient? Now I can generate those solutions. So I can walk myself through this process on a standalone question up to the point that that question is actually focusing on, in conjunction with my 6 steps and strategies that we have always taught for solving questions on the NCLEX exam. And it's the 2 of them are going to work very closely, hand in hand. And you're going to actually probably find that using both of them is going to get you much more effective solutions to your questions, and you're going to find yourself making better scores. So just hang in there, guys, because it's going to be okay. Okay. All right. Now we're going to look at these new NGN question formats. Now, most of these you're going to see in the case studies. The standalone questions, many of them will be like the current version, but some of them will be these new formats as well. Plus, there are the bow tie trend and standalone questions that will be added into the questions outside the case studies as well. But those two types of questions, that will only be about 10% of your standalone questions. So what we already figured out was there's 132 standalone questions. So only about 13 of them would be bow tie or trend questions. So still not an overwhelming number, guys, right? If I take 13 from 132, that's 120, 119, right? So 119 questions that are going to be standalone questions, very much like we currently have on the NCLEX. So it's not like they made this overarching sweeping changes to the exam that are, going to be overwhelming you with every single question being totally different from the kinds of questions we've had in the past. All right, so let's look at them so that you can see them. Okay, so the case studies will have what are called extended multiple response. That's select all that apply, presented in a different way. They will have drop-down boxes. They will have matrix or grid questions, some that will be select all that apply, some that will be multiple choice. Your drop-downs will be like multiple choices, but in several different areas. Your drag and drop, there's some questions are going to have a couple of boxes. Some will have one box that has lots of things taken out of it to fill several different boxes. So it's just going to be more, right, of what a drag and drop is. And enhanced hotspot. So instead of just putting one mark on a picture of something, you're actually going to highlight sections of text. And you can think of that question when this is an enhanced hotspot. Highlight the items that, blah, 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 right? It's a select all that apply question. That's really all it is, right? Highlight the findings that need follow-up. Highlight the findings that are of concern. That's a select all that apply. What signs and symptoms here are a problem, right? So we can do these. All right, so let's look at them. Now they all have a little, they all have a little video that has a pretty loud audio to it. So I'm going to try to cut the audio for them as we start them, but just be prepared. I don't want you to jump out of your skin when it starts playing. All right, so this is an example of an extended multiple response. Select all that apply. The nurse has been asked to prepare the patient for immediate surgery. Which of the following actions should the nurse take? It's just like a select all that apply question. You just check the boxes. Which ones apply? Use your SATA strategy and you got this. Not a big deal. So what is that going to look like when you're doing your actual exam? They're going to look a lot like this. And those sections there on the left would be able to be clicked in a different tab. So history and physical would open, lab results would open, and you have more information to use to answer your question. Okay. And so in this example, there were only 2 that were correct. And remember that with select all that apply, it can be anything from one answer that's correct to all of the answers are correct and anything in between. Right? There's no specific number, like you don't always have to pick 2 or always have to pick 3. It could be only just 1, right? That's the possibility, unless the question tells you how many to pick, right? So we're going to look at how those go in just a minute. This is the same one. I'll try to get it to go to the next slide. There we go. This is an example of a multiple response grouping, right? So this is what I call a multi-level select all that apply, right? So they give you 3 body systems and they ask you to pick all of the potential nursing interventions for that body system. So you would look at the neurologic body system, only which ones of these apply, but it would be still select all that apply. Then you would look at the respiratory system, and out of these, select all that apply. And for cardiovascular, out of these, select all that apply, right? Based on what your question setup says. So the way that's going to look is this. If I can get my thing down here. And again, you would click on each of those tabs and it would open up more information for you. and you would use that information to answer your questions. Okay, so it's going to flow just like that. Now, this is that one that I was talking about where they tell you how many to select. Select 4 findings that require immediate follow-up. It's still a select all that apply. They're giving you more than 4 to choose from. You got to figure out which 4 are the ones, right? Based on the scenario that they give you. And this is what that would look like. Right, so in this one, it sets like the 2 findings that require immediate follow-up based on the information that was on the left-hand side under the H&P, the lab results, and the flow sheet, right? So this is how you would get there. This is an example of a drag and drop. Now, this says rationale, but it's actually a close. I tried to get them to fix this in our presentation, and nobody would believe me. But this is actually a close. And so the rationale is where there's a dependency, right? This is just a grouping. So in this one, we have 1 box to choose words from, but we have 3 boxes to fill in. So you would drag words from the 1 box to fill in the 3 choices based on what your question presented to you. So this is how that looks. Let me get there. So this example is a rationale here where there's that dependency. In order for one to be true, the other has to be true, right? So you see that as a result of, right? So that's a dependency. So that's what a rationale truly is. And so usually with these, you'll have however many boxes you have to choose from for the number of spaces you have to fill in, because there's a dependency relationship. Your answer choices can't come from the same box, right? Now the closed result, right, is what we saw in that first one that was like this, right? This is actually a rationale because they have that dependency, okay? So that's why there's 2 boxes here, and you would drag 1 from one and 1 from the other. But the drag and drop close, the real drag and drop close, looks like this. And it's just filling in the blank. All right, and so then the next type is our drop down item. So similar to a fill in the blank, except for instead of dragging things from a box to fill in the blank, you're just going to select from the drop down. So this is a drop down close where the nurse is going to select, they're going to first address item A followed by item B, right? So this is a close example, and this is what that would look like. Now, the interesting thing about the drop-down boxes is that on your test, sometimes one drop-down box can help you to answer a different drop-down box. So it's a good idea when you're looking at a drop-down question to open all of the drop-down boxes to see what choices you're given to help you make your decision based on your stuff that you're told on the left-hand side and your knowledge of that scenario that they're giving you, the medications, the disease processes, etc., and the choices that they give you, because sometimes there can be a relationship between some of the answer choices that will help you to answer one that you might not be so sure about based on what the others that you are able to figure out, right? Because of how the answers are done. So this is a drop-down rationale where they're saying the client is at highest risk for something as evidenced by something. So when you're looking at your setup of your question, right, they're going to give you information about that patient. Well, when you're looking at it, if the only thing that's not correct here is, let's say, the respiratory assessment, but maybe their blood pressure and their heart rate were okay, they were alert and oriented, they were just short of breath, and their respiratory rate was elevated. So we were, looking at that. Well, if I look at my options over here, when it comes to the respiratory assessment, depending on what else they gave me, if there was pain or not pain or whatever, I could pick the correct answer based on what this is, right? So I can use this one to help me answer this one, or vice versa, maybe, right? Depending on how the question is worded. So what would that look like? It would look like this. Okay. And this is our drop-down item in a table. So similar to that matrix where, they had to select all that apply, this is a drop-down box that's the same way, right? So they gave you the 3 body systems, they give you a drop-down box to choose one thing from, right? And it says here every body system could support more than one potential nursing intervention. Unfortunately, I don't know how that could be because when you have a drop-down box, you can only select one item. So even though it says that, we haven't really seen how that could actually be true in reality, right? So this is what that looks like. So on this one, they were asking you to choose the medication name, what the drug class was, and what teaching we needed to give to that patient based on that medication. And this is an example of that enhanced hotspot or highlight item. So you would click on particular text, select it or deselect it. If you clicked it again, based on how the question is worded, right? So here is click to highlight the findings below that would indicate the client is not progressing as expected. So what shows the patient's not doing better, and you would highlight that text. So here's how that would look. Right? So that's how we would make those choices. Okay. And this is an example of highlighting in a table. So similar to that, but it's just like the table with the drop-down box or the select all that apply. You would highlight the section that was appropriate for the other side of the question, right? So it would look a lot like that. And in practice, it would look like this. This is where you would see the reference range given to you. Now, in the standalone questions, you could have questions about lab results where the reference range is not given to you. But in the case studies, the reference range will be given to you, okay? And this is an example of that matrix grid. So the first one is a matrix multiple response item, and the second one is a multiple choice. The difference being that in the top one, you can pick more than one option, right? And so on your actual exam, these will probably be squares because usually if you can pick more than one, they're squares. So the assessment finding based on the story they give you on the left-hand side of the screen whatever's going on with their appetite. That assessment finding, would it indicate the patient had a bowel obstruction, appendicitis, ruptured spleen, 2 of those or all 3 of them? And the same with the pain level, the bowel pattern, and the gastrointestinal systems. With the matrix multiple choice, you can only pick one. So based on what you have going on the left-hand side of the screen, is that respiratory rate of 36 an improvement, no change, or a worsening of the condition, right? And the same with each of the other options. So you would only be able to pick one. Okay, so that will look like this. And then this is the multiple response. All right, now those 2 special standalone items, the bow tie and the trend, this is how they look. So you're going to start with this, what looks like a little bow tie, right? This is the little center square section, usually, or rectangle section, and then the little bow on each side. But with the bow tie item, you always start in the middle. You start with, what do you think is actually going on with the patient? So potential condition. And then based on what you think is happening with that patient, and this decision is made off of the information they give you off to the left, you're going to choose 2 actions that you would need to take because of that condition. And once you know what 2 actions you're going to take, then you're also going to choose 2 things to monitor because of that condition and or those actions you took. So that's how your bow tie is going to work. And this is what it would look like. Let me get my thing up here. Okay, so that was how that would go. And then this is our trend item. Now your trend item is something that's just, they're giving you data that occurs over time. It could be over minutes, it could be over hours, it could be over shifts, it could be over days, over weeks, even years. So depending on what your question is and how that data is presented, then using that data, trending out the intake over this, 6 hours here, the output over the 6 hours, what the patient's report is to the nurse when they go to do this check-in with them for eyes and nose every 2 hours. So based on this information and our setup here, this is a patient who's had nausea and vomiting for the past 3 days, and this is their flow sheet and nurse's notes for the last since, from 8 to 12, right? So basically from 6 a.m. to noon. So based on this information, I'm going to then answer this select all that apply question. And that's all that a trend is. It's really just like any other question, and the information is just presented a little, it's just a different set of information, right? Presented over time instead of just a snapshot. So that's all that a trend item is. So how would it look? Just like this. So as you can see, you have your initial assessment of your patient when they came in, their 9 a.m. Nurses check, their 11 a.m. nurses check, and then you had some flow sheet information, probably with different timestamps as well. And you had to answer this question. It's again a matrix select all that apply. So a standalone question with this matrix select all that apply presentation that we saw earlier that could also be in your case studies as well, right? So your standalone questions can have those new types of questions like you'll see in your case studies, as well as the same kinds that you currently see for this current version of the NCLEX. All right, so total number of items, like we said, 85 to 150. So a minimum of 85 in order to pass the exam, up to a maximum of 150. 15 of the first 85 questions will be the pre-test unscored items that are being tried out to see if they're good for a future version of the NCLEX. And 18 of the questions will be in the 3 unfolding case studies, also occurring within the first 85. So the first case study will be in the first third of those 85 questions. The second case study will be in the middle third of those 85 questions, and the third case study will be in the last third of those 85 questions. So question 86 forward, every question will be a standalone question. There will be no case studies after question 85. So you'll have done the hardest part, really, I guess, in most people's minds, up to that point. And then you just move forward and answer each question as it comes. Now, that also means, though, that the scoring is a little bit different, right? And so currently that confidence interval is a little bit different in how it gets determined. And there's a really good video, and I'll actually try to pull that up once we're done here with this presentation before we finish up to show it to you, that shows you how that confidence interval works. Because now, if you are very close to the passing standard, the closer you are to the passing standard, of course, the more questions you're going to get. Because when you first start out the exam, the variation from the passing standard is very, very large, right? So first question is always on the passing standard. You get it right, you're going to be way up here. You get it wrong, you're going to be way down there. Sorry, guys. And then, you know, as you get more questions right or wrong, then it's going to have a slighter different variation, or more questions in a row correctly. It's going to keep going, you know, in that upward direction. But the farther along you go, the less fluctuation there is from question to question in the line. So it stays closer to wherever it currently is. And if you're well above the passing standard, it's going to shut off at 70 or 85 questions. But if it is very close to the passing standard, it's going to give you lots of questions up to the maximum number. And it's a lot easier to end up hitting the maximum number with the NGN than it is in the current version as a result. In order for it to close at the 85%, 85 total questions, then you have to be well above the passing standard, or, you know, truly below the passing or right on the passing standard, right? And that's going to cause it to close earlier. So getting those hard questions from the beginning and staying up there, that's your best bet, right? So that's why we say take your time, do not rush, especially these first questions. You want to do as well as you can from the beginning of the exam so that you can be way above the passing standard and have less fluctuation in questions that you might miss later in the exam, as opposed to, you know, being closer to the passing standard and having more fluctuation and being right on the exam on the line at that point. So you don't want that, because that's what happens here, right? See, they're way below, and so as they get closer and closer, they finally get close to the passing standard, but they never get quite above it, because the farther along they go, there's less fluctuation in the line. Okay. So let's talk about scoring. So how is it going to be scored? The current version is dichotomous scoring. You have to get it all correct, totally correct, including the select all that apply, in order to get the question correct. If you miss anything, it is wrong, right? So it's either right or wrong, and that's it. With the NGN, there is polytomous scoring. So there is this plus minus method, there's this 0-1 method, and this rationale method. And so what does that look like? It looks like this, right? So partial credit can be assigned in 3 ways. The first way is this plus minus, where they lose a point for missed answers and they gain a point for correct answers, right? So this would be an example of that. The question is, what countries are in North America? There are only 3, so you get 1 point for each correct answer, a total of 3 possible correct answers. But if you miss one, 2 minus 1 is 1 point, right? So because you got 2 correct and you missed 1, so 2 minus 1 is 1 point. But if it's 0-1 scoring, then you get 1 point for your correct answers and you lose nothing for your incorrect answers. You just don't get any points, right? So they don't take anything away. So the same question could give you 2 points out of 3 if it's scored as a 0-1 versus 1 point out of 3 with the plus minus. The thing is, we don't know which way what question is scored, right? So there's no way for you to know that. You just have to trust and do the best you can on every question. Now, the next way that we can do partial credit has to do with this, what we call rationale method, right? So in this one, you can only get all or nothing, right? Because picking the country, right? There's not really a right or wrong there. It's whatever country you pick, that's fine. But the real kicker is, did you pick the right capital, for example, in this question? So the capital of France is Paris. That's correct. It's a city. But the capital of Egypt is not Japan. It's another country. So if I put a different country here, or I put an incorrect city, right? I chose Okinawa instead of Cairo, well, then I'm not going to get this question correct, right? So this is going to be a nothing. This is going to be a 1 because they're connected to each other, right? I have to get both of them correct to get the question correct. And it's a 1 point question. So the big thing is mark your calendar, right? But those of you that are just coming into the program recently, then you know for sure you're taking NGN. Those that got pushed into April, you know you're taking NGN too. That's why you're here. Just know though that April 1st is the big day that this does go live. All right, so while we're looking at this, I'm going to go ahead and pull up this other little video that they gave us from NCSBN, and I have that in my little Teams chat here. I think she put it in. I think she put it in the huddle chat. Let me find it really quick. It was before that. It will take me just a second, guys. I'm so sorry. Yeah, it's this one. Let me get here. Copy link. And let me go here and do this. All right, so let's listen to our NCSB guy.
Then you need to know about CAT, computer adaptive testing. In this video, we'll not only tell you what CAT is, but also help you understand why we use it and what it means for you. The purpose of a test is to measure something, like knowledge or a set of skills. Let's think of nursing knowledge, skills, and abilities as traits that can range from really low to really high along the continuum. At the high end, the student who gets A's on everything. And on the other end, the student who, let's just say, decent. With the traditional test, finding out precisely where a candidate falls on that scale requires a lot of questions. That's why CAT is so important in the design of the NCLEX. Computer adaptive testing provides the most precise measurement with the least number of questions. The secret of CAT is adapting the questions you see based on your previous answers. Let's take a look. Here's our scale again. Let's label the scale from -3 to 3, since that's about the range we use on the NCLEX. The test begins with a question of medium difficulty, which we'll put right at 0 on our scale. The test taker can either get this question right or wrong. Suppose the candidate responds correctly. Then the CAT algorithm estimates an ability greater than 0, but places a lot of uncertainty around the estimate because there's only been one question. On the graph, we might show this as a dot around 0.5 to mark our estimate, but a very wide interval to acknowledge the uncertainty of the estimate. Now, the key feature of CAT is what happens next.
So when they're showing you this is, so think about your nurse achieve graph that we showed you earlier, that big wide jump, right? From the beginning of the exam, the question 1 would be like at 0, right? So question 1 was at 0, and when you get it right or wrong, there's this big jump on either direction. And that's what this big blue line is related to, is that big jump, right? And then as you progress through the exam, the fluctuation of your performance graph is going to be lower and lower. And that's what he's going to show you. They show you it here on the horizontal, whereas we show you on the vertical in comparison to the passing standard. But it's the same idea.
Instead of getting a second question at random, the computer now selects a question right around the test taker's ability estimate. If the candidate answers correctly again, our estimate of the candidate's ability goes up even more since they just got an even harder question right. But something else has happened too. The uncertainty from before has also shrunk a little. Because we have information from 2 questions, we have more confidence in our estimate than when the candidate had answered only 1 question. On a CAT exam, our estimate of a test taker's ability can change after each new question. When the test taker correctly responds, their ability estimate goes up, and they see a more difficult question. When the test taker responds incorrectly, their ability estimate goes down, and they see an easier question. As the candidate responds to more and more questions, the uncertainty continues to shrink, and the ability estimate becomes much more precise. Let's jump ahead now and see how things might look after 85 questions. We can see that the candidate's ability estimate has increased a little, but more importantly, the uncertainty around that estimate is now much less. In fact, our ability estimate is now so precise that we may have enough information to determine whether this candidate should pass or fail the exam. For the remainder of this video, we will assume the pass-fail cutoff, sometimes known as the passing standard, is at 0.5. We can see from the graph that our candidate's ability estimate, even accounting for any uncertainty, is clearly above 0.5. The candidate would therefore pass the exam with what is known as minimum length pass. 85 questions is the earliest a pass result can be determined. Of course, other results are possible as well. Let's look at a different candidate's graph after 85 questions. Here again, the ability estimate is very precise and clearly below 0.5, even accounting for any uncertainty. This candidate fails the exam with what's known as minimum length. Let's now look at a third candidate following 85 questions. Here, the ability estimate is right around 0.5, our pass-fail cutoff for this video. But the uncertainty of the estimate allows for an ability that might be just above or just below the passing standard. In other words, we do not yet know whether this candidate should pass or fail. The way we do that is to select additional questions for the candidate to answer, all the way up to as many as 150 questions. By this time, the uncertainty will shrink to nearly 0, and our ability estimate will be precise enough to determine a result. Sometimes the terms maximum length pass and maximum length fail are used. An ability estimate above the passing standard results in a pass, and one below the passing standard results in a fail. Now that we've covered everything, here's a brief quiz. True or false? A friend's exam was the minimum length. This means they failed for sure. This is false. They could have failed, but they also could have passed. We've looked at examples today of the minimum length pass and the minimum length fail. Both situations occur quite frequently on the NCLEX. Therefore, if a test taker receives the minimum number of questions, either a pass or a fail is possible. True or false? A friend's exam was the maximum length. This means they passed. This is also false. A maximum length exam occurs when the test taker's ability estimate is very close to the passing standard. If it is just below, the test taker will fail. And if it's just above, the test taker will pass. True or false? The test taker's ability estimate stays the same throughout the entire exam. This is definitely false. The whole idea of CAT is that your ability estimate changes after every question. True or false? The uncertainty of a test taker's ability estimate shrinks after every question. Yes, this is true. And that's one of the other key features of CAT. Our estimates get more and more precise after every question. The use of CAT on NCLEX ensures that your exam will take hours, not days, and will provide a very precise result. Ultimately, of course, this result will be based on how well you demonstrate your nursing knowledge, skills, and abilities. So do your best on each question and know that no matter how long your exam is, the only way to know if you pass or fail is to await your results.
All right, so I hope that's a little helpful. And so what he's saying there is that you can definitely get, a pass or a fail at either the minimum number or the maximum number of questions. So just know that wherever your exam shuts off, it doesn't matter how many questions you got, and it doesn't matter how long it took you. Either way, you could have passed or you could have failed. We don't know until we get the result. And so the way they were moving that little line along the horizontal line there is the way your performance graph moves on the vertical, right, with your Nurse Achieve. So I'm actually going to open our PowerPoint back up and go back to that slide. Let me just go to from the beginning here, and then I can come here and do this. It's going to be here, right? So the way that this line goes up and down here is the way they were sliding it here, right? So when they did the first one, you had that big long blue line. Well, this is that long blue line, only it went this way because they missed it. They got it wrong. And then as they answered more questions right, it becomes more precise. And so this is an example of several questions in a row and the ability estimates moving up in numbers, right? And so the same thing here. They got several questions in a row correct. The first question was right. It took them, way far away from the passing standard. But the more they answer questions, the shorter that wavelength is going to be, the fluctuation in the line. Which is why if you can get way above the exam, the passing standard from the beginning, you're going to have a better opportunity to get a pass, because the farther you go, the less fluctuation there is, and you're more likely to stay above the passing standard. You'd have to get multiple questions in a row incorrect to get all the way back down here, because it would have to keep moving down question by question by question. And that can happen, and you'll see that on some adaptive exams. And one of the things that we show you in our Getting Started with Study coaching calls that you do on Zoom with your instructor is going to show you the difference in the different designations in Nurse Achieve, and you'll be able to see that pretty clearly, how the more questions you answer incorrectly leads to a higher graph, and the more questions you answer the more questions you answer correctly leads to a higher graph, and the more questions you answer incorrectly leads to a lower graph, because it does it on the vertical versus the horizontal. So I hope this is helpful, and you guys feel a little bit better about taking the NGN, and know that we are preparing you to answer these questions successfully. So come to the Question Clinic webinars in particular, come to Zoom calls with your instructors for strategies coaching. Attend your Getting Started and how to answer questions successfully Zoom calls with your instructors. Schedule open forum calls if you get to a sticking point where you're having trouble with anything, or one-to-ones based on how your instructor has those set up. And just know we are here for you guys to help you be successful. So I hope this was helpful for you. We will have a Question Clinic for this week in about 10 to 15 minutes. So please take this opportunity to run to the restroom, grab you a drink and a snack, and come on back. I hope to see you in just a few more minutes. All right, guys, y'all have a great night.